This presentation will review how to complete some of the childcare forms that were new in 2021. In this presentation, the forms that we will be reviewing include the sleep isolation log, the illness symptom tracker, the tablet sign-out and visitation tracking sheet, and the daily shift report. The first form that we will be reviewing is the sleep isolation log. The 2021 form combines the previously separate sleep and isolation logs to allow tracking the same information without having to use different forms. It is essentially the same format as the previously used sleep log, with the addition of a column to indicate if a child is in isolation. There are 5 different versions of this form, one for each shift, so be sure to use the correct one for your shift. Put the child's first and last name on the form. Use the comments column to document any noteworthy activities, such as starting or ending isolation, awakening to use the restroom, or when the child is away from the unit. Signatures should include both your first and last name. Childcare forms are official medical record documents and may be reviewed by outside entities such as auditors or courts. So it is important to correctly identify yourself when printing or signing your name on childcare forms. Do not use nicknames, initials, unless the field specifies initials, or partial names. Completing the sleep isolation log. First, put the child's first and last name, the date, and throughout your shift, document the status as A or S for sleep or awake. You can also use this column to indicate if the child was off the unit, as this child was at 6 and 6:15. Use the comments column to document any noteworthy activities, such as a Zoom visit or a nurse visit. If an activity extends across multiple status checks, you can use an arrow to indicate that. In this situation, Jill wasn't feeling well and went to the nurse. It was determined that she should be in isolation, so this is indicated in the isolation column, along with in the comments, mark the time that isolation started. Continue to check the isolation column as long as Jill is in isolation. You can use an arrow to indicate that she remained in isolation throughout multiple status checks. In this situation, Jill fell asleep at 7:45, but she awakened at 8:45 to use the restroom, so you can document that. She also requested water. And finally, at the end of your shift, you will sign your first and last name, as will your supervisor. Next, we will talk about the illness symptom tracker. With the addition of checkboxes, the 2021 illness symptom tracker provides an easier way to identify your shift when using the tracker and to ensure that the tracker is used during every shift. When in use, symptom trackers should be completed on each shift. There should be no gaps in shifts along the top of the form. Write both your first and last name for assigned worker. In the pre-visit section, document the symptoms shown during the visit, record the child's temperature at least once during the shift, and indicate the time the temperature was taken. Note any efforts that were made to manage or monitor symptoms. Indicate if the on-call nurse was contacted, and if so, what were the instructions. If the child is seen by a medical provider, note the date and time of the visit and the results in the post-visit section. Continue to complete this form on each shift until symptoms have resolved. Completing the illness symptom tracker. Write in the child's first and last name, date of birth, and age. Recall Jill from the sleep isolation log example. She started not feeling well during first shift, so they started the symptom tracker. They write in the shift, the date, and first and last name, along with symptoms that are present, and they take her temperature and document the time. They indicate any attempts to manage the symptoms, and in this case, the nurse was not yet called. The tracker is passed along to second shift, who documents their shift, the date, and first and last name. They document symptoms and recall that during second shift, Jill had spiked a fever. And since her fever was 100.4 or higher, the nurse was called. Jill was able to be seen, and it was recommended that she be given children's Tylenol. The results of this visit are documented under post-visit. It is also a good idea to indicate the time and date that the sick visit occurred, along with the recommendations. Attempts to monitor the symptoms are indicated, and it's indicated that the child was placed in isolation. And recall from the sleep isolation log that Jill had woken up to use the restroom. Staff took this opportunity to also take her temperature and document it. Third shift continues to complete the log, following the prompts, as does first shift the next day. The tracker continues to be completed as long as symptoms are present. It is a good idea to continue to use the tracker until the child is symptom-free for 24 hours in order to ensure that the illness is completely resolved. Next, we'll review the tablet sign-out and visitation tracking sheet. This form serves two purposes: to track the usage and maintenance of tablets and to track required visits. To demonstrate completing this form, we'll use Jill as an example. Recall from the sleep isolation log that a Zoom visit was documented. The worker indicates the date and time that the tablet was signed out, they put their initials, and indicate the children on the visit. If there are multiple children on the unit with the same first or last name, be sure to include both the first and last name of the children on the visit. This will help correctly identify who was on the visit. And then when the visit is over, indicate the date and time that the tablet was signed back in and cleaned. And finally, we will review the daily shift report. The 2021 Daily Shift Report introduces additional selection fields in order to reduce missing or blank fields. There are 3 different versions for various age ranges, so be sure to use the correct one. This form brings together all of the information from other forms. All forms should match. Use first and last names for both the child and the assigned childcare worker. When completing the infant form, remember to update the age each month. For example, a child born on 4/19/21 and was admitted on 6/12/21 was 2 months old at intake, but turned 3 months old on 6/19/21 and 4 months old on 7/19/21. Be sure to increase the age as time passes. Do not leave any fields blank on any form. If there is not a checkbox to indicate that something is not applicable, indicate this by writing none, a 0 with a slash through it, or NA. To demonstrate completing the daily shift report, I will break them down into sections, starting with page 1. We will again use Jill as an example, and since she is 5, we will use the school age daily shift report. In the first section, circle the shift, write the child's first and last name, the date, the child's age, and the first and last name of the assigned childcare worker. In the next section, indicate what drinks were given to the child during the shift. Indicate what type of milk was given and what type of cup was used. Each time the child is offered something to drink, document the time, what the drink was, how much was offered, and how much the child drank. Use the drinking notes to indicate any notes. And remember that Jill had a sore throat and was having difficulty swallowing, so this is noted. Also under special care, she is given fluids if requested. If there are no drinking notes or special care given to document, indicate both of these fields as none, a 0 with a slash through it, or NA. Continue to document the drinks that the child took in during the shift. Recall that Jill had woken up and requested water. This is documented. In the next section, identify what foods were given to the child during the shift. Identify on the top if the child was given soft pureed table food or regular table food. In the first column, identify what meals and snacks were given. Since this was second shift, dinner was served at 4:45. In the second column, indicate what foods were offered during that meal. And in the next columns, indicate how much the child ate. Under feeding notes, indicate if there were any concerns. In this case, the child was having trouble chewing and swallowing due to having a sore throat. If no food is offered during the shift, such as third shift, use this column to mark no food offered during this shift. Checking this box will serve to identify why none of the previous columns were filled in. So in this case, leaving them blank is acceptable. However, remember that in most cases, fields should not be left blank. Continue to fill in the form when additional food is offered, such as evening snack. And then indicate if there are any special care given. In this case, there was none, and none needed is checked. And finally, at the bottom, indicate any overall feeding summary for liquids and food. In this case, the child was not feeling well with a sore throat and fever. However, she did try to eat most things, but she's being encouraged to drink fluids. In the next section, you will document the child's toileting habits. Depending on the age of the child and the form being used, the top of this form may look different. In this case, Jill is 5, and we indicate that she uses underwear. We document the time that she used the restroom and if it was urine or a bowel movement, and we do this throughout the shift. We check off any appropriate toileting notes or indicate no concerns. And we also indicate if special care was given or if there was none needed. We are now ready to talk about page 2. At the top of page 2, we will document the child's sleeping habits. Check off any applicable sleeping notes or indicate no concerns. In this case, the child was in isolation due to illness and is being monitored for symptoms. Indicate if any special care was given. In this case, the staff stayed in the room and the child woke up to use the potty. And finally, complete the overall sleep summary. The child was not feeling well but was able to sleep. Before completing the section called Other Items, we will take a closer look at some of its subsections. The first subsection that we will take a closer look at are the parent visit and parent called fields. Since Zoom visits have temporarily taken the place of in-person visits, a scheduled Zoom visit should be indicated as PRV or parent room visit and not as parent called. Indicate the time of the visit so that it can be matched to the tablet sign-out and visitation tracking sheet. If the parent is called for any reason, it is helpful to note the time and the reason for the call. The next subsection that we will take a closer look at is the child has medication fields. If a child has any medications listed on the medication general log, the field labeled Child has medication should be indicated as yes, even if it was not given on your shift. If no prescription medications were given on your shift, indicate none next to the field labeled Prescription, list those given on this shift. Otherwise, list the medications that were given. If no over-the-counter medications were given on your shift, circle none in the field labeled OTC, circle those given on this shift. Otherwise, circle or list the medications that were given. Note that this section applies only to medications that are listed on the medication general log, including both prescription and over-the-counter. It does not apply to preventative medications. What are preventative medications? Preventative medications are those that are kept in bathrooms or at changing stations and are not assigned to a specific child, such as lotions or diaper creams. Preventative medications are not listed on the general or medication logs and are the only medications that child care staff, other than shift supervisors, are permitted to administer. If these medications are administered, they should be indicated on the daily shift report under Special Care Given in the toileting section, not in the medication section. If a preventative medication is recommended by a medical provider, it then changes from preventative to prescribed and is then listed on the general and medication logs, thus can only be administered by the shift supervisor and will be recorded in the medication section on the daily shift report. The final subsections to take a closer look at are those that contain the critical incident required fields. There are two places on the daily shift report to indicate if a critical incident was required to be completed. One area is under health concerns and pertains to medical situations that require a critical incident report to be completed, such as an injury or a communicable disease. The other area is under behavioral concerns and pertains to any behavior-related situations that require a critical incident report to be completed, such as physical aggression or property damage. Since these two areas refer to different situations, responding yes to one does not necessarily mean the other will also be yes. Now that we have taken a closer look at some of the subsections, we can now complete the entire Other Items section. Was there a parent visit? And if so, what type of visit and when? Was the parent called? If so, when and for what reason? Does the child have medication? Jill now has medication because she has been given children's Tylenol. Were there prescriptions given on this shift? If no, write none. Were there any over-the-counter medications given on this shift? In this case, Jill has been given children's Tylenol. Are there any health concerns? If so, what are the symptoms? And was a critical incident report required? In this case, yes, because Jill saw a medical provider for a non-routine visit. Indicate if an illness symptom tracker is in use, and if so, is it a new one or a continued one? In this case, it's continued, because they started one on first shift and this is now second shift. Indicate any temperature checks that were taken during this shift. In the next column, indicate how the child felt today. Today Jill felt sick. And indicate things that the child did. She had a Zoom visit with mom and she went to the doctor. Indicate any milestones that have been achieved. If none, write none. Indicate any behavioral concerns. If none, write none. And was a critical incident report required? In this case, no, because there were no behavioral concerns. And finally, indicate any shift conclusions and special instructions for the next shift. We will alert the next shift that the child is in isolation due to fever, aches, and a sore throat. She saw the NP, has been recommended Tylenol, and we will continue to monitor for symptoms. The final step for completing the daily shift report are the signatures and dates. First, the staff member completing the report will sign first and last name and date. Then, the child care supervisor who reviews the form will sign his or her first and last name and the date. And the oncoming worker will initial the form after reviewing it, as will the oncoming supervisor. This concludes the training on some of the 2021 child care forms. If you have any questions about completing forms, please ask the shift supervisor, the nursing operations manager, the compliance and quality manager, or the director of programming and clinical operations.